And that brings us to the rationale for the program we've created in Cleveland, Ohio. We, University Hospitals Cleveland Medical Center, the largest health system in Northeast Ohio, partnered with AmeriCorps, a national service organization, in 2015. Lay people are trained to counsel smokers and arrange for pharmacotherapy to help smokers quit. And these coaches work alongside clinicians in primary care practices, working with smokers who are referred to them. Now, why the rationale for the toolkit? Training laypersons in MI and tobacco cessation counseling is time-intensive and can be, for many places, cost-prohibitive. MI delivered with high fidelity requires ongoing feedback with a validated measure to improve and ensure maintenance of high-quality delivery. I personally have trained over 200 lay people by individually instructing them and personally listening to their recorded conversations, rating those conversations using a validated instrument, and providing the learners with feedback until they reach an objective standard of competence, and then repeating that assessment periodically to ensure maintenance of competence. Knowing that this was difficult to sustain, I imagine that if we could make this training accessible online and train the learners to rate their own conversations, to learn the coding instrument that I've been using to give learners feedback and ensure competence in motivational interviewing, the program could be highly sustainable by allowing these learners to provide each other with feedback and cost-effective, capable of great scale and spread. This brings us to the course description. This course begins with the learner becoming familiar with MI through short online videos. Next, the learner becomes familiar with the Motivational Interviewing Treatment Integrity, or MITE. This is the rating system used to evaluate conversations for the interviewer's fidelity to MI. After that, a group of learners gets together to rate recordings of interviews using the MITE coding instrument. The group continues to code together until they all reach an excellent level of agreement in all measures of the MITE. You'll also learn in these modules how to access and use statistical software to measure the level of your group's agreement. After becoming familiar with MI and skilled at the use of the MITE, you'll get together in small groups to conduct structured exercises to practice the skills you learned about in the introduction to MI. You'll learn about effective interventions for tobacco cessation in more online training. And then you'll participate in role play in pairs where one learner is the interviewer, the other is a smoker. These conversations get coded using the MITE by the group, and the interviewer gets feedback to improve their performance. Each learner continues this role play until each member reaches basic competence in MI, as measured by the MITE, and then you'll be ready to see patients. Our course and the online toolkit goals. By completing this training, participants will be able to achieve excellent agreement as a group in the MITE coding instrument, attain basic competence in MI according to a validated measure, demonstrate knowledge of effective interventions for tobacco cessation, and successfully coach smokers to quit. You have in your toolkit a table describing the 8 topics covered in this curriculum and toolkit. We'll go over each one now.